Black women are 3 times more likely to die from a pregnancy-related complication. To walk us through this morning, we have Dr. Armstead and Dr. Christian from Syncare Medical Practice. Uh, Audience, Dr. Christian is the Chief Medical Officer at Syncare, who is a board-certified physician executive with over 30 years of progressively greater responsibility in for-profit managed care organizations. Dr. Christian, this is alarming. Black women are 3 times more likely to die from pregnancy-related complications. Why is this, and what are the facts?
You're absolutely right, JR. And that is a national figure for Black women to die from pregnancy complications 2 to 3 times white women. And in New York, the problem is even more riskier for Black women. It's somewhere between 4 to 5 times more likely to die during pregnancy. And this is a crisis. And I'm very happy that awareness is increasing across the country. And the Black Maternal Week that we just had from April 11th to the 17th is highlighting this and making this a campaign that increases awareness about this problem. But why is this happening? Well, Black women do suffer from a higher prevalence of medical conditions such as hypertension and diabetes and obesity, which could increase the risk during their pregnancy. But in addition to this, there's what we call unconscious bias or stereotyping or discrimination that occurs with Black women in the healthcare delivery system, not only for maternity, but across the board. But this unconscious bias or conscious bias also creates a situation that increases the risk for Black women as well.
So, Dr. Christian, so there are racial disparities that Black women are confronted with. Am I
Absolutely.
correct?
Yes, there are racial disparities that are occurring in the system that contribute to this problem. Black women have difficulty conveying and being listened to by their providers, and providers are not listening and addressing all of the issues that Black women may have if they have increased pain or are having difficulty with bleeding or any of these complications. They can be ignored.
So are most pregnancy-related deaths preventable?
I would say between 60 to almost 80% of these deaths are unnecessary. They are preventable. And they are preventable because medical conditions like high blood pressure and diabetes need to be specifically controlled so that people are stable, women are stable during their pregnancy. If they have these conditions, they need to be addressed. And then the unconscious bias and the discrimination, if that were eliminated, that would also be a reason that these deaths would be prevented.
So how do we reduce the maternal mortality? How do we reduce it?
We have to reduce it by, first of all, we have to talk to each other. Our system is very fragmented. We need innovation around perinatal care. We have obstetricians, we have nurse practitioners that are OB nurse practitioners, there are midwives. But I think that having doulas and community health workers and creating a team can increase access around maternal care and can reduce some of the fragmentation. We need to address the social determinants of health, housing, food insecurity, transportation to medical conditions. We need to include a more home-based strategy, care in your home, coming out to the home and providing some of the education and coaching, either through a doula or through a community health worker. So there are a lot of creative ways that we can address this, but we have to address it in a team-based approach, in a maternity care approach that includes providers and includes community-based strategies.
Thank you, Dr. Christian. Before we bring in our panel, I would like to welcome in Dr. Armstead. Good morning, Dr. Armstead. How are you?
JR, always a pleasure. I'm doing very well. Thank you.
Audience, Dr. Armstead is the Chief Medical Officer of SynCare and Care Medical Practice. Dr. Armstead, SynCare, what could you tell us that SynCare is doing to deal with this crisis that we're having?
As it relates to Black maternal and child, first of all, I'm delighted to have my esteemed colleague and working partner for several decades, Dr. Christian, to be part of the team. But think of it this way, it's a community approach. Everything we do, JR, is about not a market, but we define it as a community. The family members as we define it, because we believe that you will care for a family member more than referring to someone as a beneficiary or just a patient, requires an approach where you kind of understand all of the things that are necessary to be effective in that community. So specifically the Black maternal child, um, we are basically making that one of the kind of 3 or 4 clinical verticals in addition to the routine things we do to kind of like address care regularly with many of the members that are, family members that are being seen by our providers within our networks. We're focusing on four major conditions. We understand the importance around, heart disease, hypertension, etc. We understand the importance around dementia, which we recently awarded through the Center for Medicare and Medicaid Services under Dr. Christian's leadership and our Chief Strategy Officer, Gary Backer, an award to begin a dementia program to specifically target on that, as evidence has demonstrated that Blacks and Browns are increasingly impacted by early dementia that, if not recognized, becomes increasingly challenging. So there, in addition to that, things like glaucoma, but the Black maternal and child, we are actually rolling out programs in multiple markets consistent with our clinical model. Right now, we're doing a particular focus in Buffalo, where we are very focused with building out an intervention with clinical staff and likely involving additional folks in the market. So to address this, to Denise's point, you have to kind of be committed to just saying that you're going to be intentional about this, and then being an intentional about this, we're basically investing resources ourselves, but we have also been able to align with the variety of community organizations and grantees to help us kind of like move these types of services into specific targeted markets. So right now it's Buffalo. We're going to pivot this to Brooklyn, and then there are other markets in Georgia and elsewhere where we've kind of rolled out, where we're kind of deploying this specific focus to address this crisis, if you will, on Black maternal and child.
Audience, if you're just joining us, we're having a conversation around Black maternal health. We have our medical consultants here breaking it down for us, making us aware of the things that we could do to get past this crisis. Again, Black women are 3 times more likely to die from pregnancy-related complications. Nurse Patricia, your question for Dr. Christian until we get Dr. Giddings back in.
Good morning, Dr. Christian. Good morning, everyone, to our listeners as well. And Dr. Christian, thank you so much for this very necessary discussion, because Black maternal health is a very necessary topic that needs to be discussed because of all the disparities that exist in that area of health. The question I have for you, so I know you mentioned various strategies that you're utilizing to kind of bridge the gap and to decrease this statistic that exists with Black maternal health. One of the things that I've been researching about lately is virtual health. And there are lots of studies and research that shows that not just in maternal health, but just other areas of health, that virtual visits, virtual health is a strategy that is being utilized to encourage more people to access health because we all know that one of the challenges is access. One of the challenges is just finding the time to go to the appointments and to see their obstetricians and things like those. But almost everyone has a smartphone, and it wouldn't, it would be easier for a mother to spare 15 minutes on their break from work to have a quick catch up with their obstetrician virtually. So I just want to hear what your thoughts are about this innovation and how you foresee it being able to help with this statistic that we're talking about. Thank you.
Well, yeah, thank you for that question, because it is critical that we move away from the traditional, you have to go to the doctor's office to see the doctor. There have to be other ways that we can communicate with our patients. And you're absolutely right. Virtual care is extremely important and has really expanded since COVID as well. So SynCare does, and Care Medical provides telemedicine services. We do that with using the smartphone. As you say, many members do have smartphones. So we provide not only in-home care in person, but also through video as well. And we have to be creative in providing that service. We can have community health workers go into the home as well and actually hook up the member, the patient, to the provider, and they can have that type of video visit as well. So you're right, we need that type of innovation so that we have just not the traditional brick and mortar going to your doctor's office, but provide text messaging, video visits, and other such digital strategies through apps to provide care.
Thank you so much for that.
Welcome in. Good morning, Pastor Straker. How are you? We are continuing this conversation around Black maternal health and the racial disparities that we face as a people. What question would you like to ask Dr. Christian this morning?
Well, good morning. Good morning, doctors. Thank you so much for addressing this. This is such a critical issue in our communities. I want to believe that the statistics are even higher in our area where I live in central Brooklyn in terms of Black maternity health. And so some of the questions have already been asked, so some of the things that I had wanted to talk about, the telemedicine and some of the social determinants that reflect in the racial disparities in terms of healthcare. But when you see what's happening in the healthcare systems, for example, we just had a rally last night to fight to keep downstate open. And this talks about, closing. And it seems to be this model of in the nation moving away from the outpatient care to, the inpatient care to a more outpatient care model. Where do you see that affecting areas that are predominantly Black and brown, where you have these disparities? How do you see that model somewhat either benefiting or hurting Black maternity health care?
I think that in New York, and we've seen this across the country, there have been hospitals that are closing down that are providing obstetrical care. And it's leading to what we call maternal deserts. And in fact, 35% of the counties across the country are maternal deserts. And there is not access to maternity care where there should be. Either there's not an obstetrician or there's not a facility that's providing that care. and they're not birthing centers. And we as a nation need to address this. We need to be able to provide access in a way that someone doesn't have to travel an hour or two to see their obstetrician. So that may be, in the meantime, having mobile vans, the telemedicine that we spoke of earlier. We need to promote birthing centers, not close them down, but increase the number of birthing centers that are in our communities, and the midwives that are part of those birthing centers. So there's a lot of work that needs to be done to increase access.